Today I want to talk to you about something that's often overlooked. The risks that we face as nurses and healthcare professionals when working with hazardous medicines such as chemotherapy. Chemotherapy is cytotoxic, meaning it's toxic to cells. And while it's a lifeline for many of our patients, it can pose serious health risks to those who prepare, administer, and clean up after its use. And it's not just chemotherapy. Many other hazardous medicines are used to treat conditions even outside the cancer setting. Exposure can happen in many ways: a damaged infusion bag, a dropped syringe, patient emesis, and even tiny microscopic vapors that are released during administration. Did you know that a spill, just 5 mils or barely a teaspoon, is classified as a large spill in terms of safety concerns? The consequences of exposure are real. Research has shown that occupational exposure to hazardous medicines can lead to adverse health conditions, some of which can be serious and long-term. A recent integrative review revealed that 14% of nurses reported a spill or exposure within just 1 week. Despite the availability of guidelines from various national and international organisations, adherence to safe handling procedures remains inconsistent. There is a strong need to ensure that both nurses and cleaning staff are made aware of the risks of exposure, spill or no spill, and have policies and training in place to ensure that this is done safely. There are pieces of equipment called closed system transfer devices, and while these certainly reduce the risk of exposure, they don't totally eliminate it. Across the globe, there is a lack of standardised chemotherapy-tested PPE, especially for critical zones like patient rooms and waste disposal areas. That's why training is so vital, not just for nurses, but for cleaning staff and anyone else that might come into contact with these hazardous drugs. We need to be equipped, informed, and protected. Because here's the issue. As nurses, we care deeply for our patients. But in doing so, we can forget to care for ourselves. It's time we change that.